Hello everyone. So today in this video we are going to see the case study on nephrotic syndrome. Okay. So first you'll have to write the identification data, name, gender, date of birth, what is their age. Then you'll have to write when were they admitted to hospital and when you did the assessment. Then what are their diagnoses and if they are undergoing any surgery. Okay, that also have to be mentioned. Next come their present medical history. So you'll have to write the chief complaints that your patient came with. So here my patient came with the complaints of facial puffiness since 7 days, then swelling of the limbs, abdominal distension, cough since 3 days, and also there was the history of urine output which was decreased. Okay, so everything you'll have to mention. Next come the antenatal history of mother. So here you'll have to write whether the mother had taken both the TT injections, okay, whether she had proper antenatal checkups, then she had undergone any screening or the USG, okay, or whether she had any infections during that time and she had taken calcium or folic acid tablet or any other tablets. Everything you'll have to mention here. Now in the natal history you'll have to write how was the baby born, then what was his this weight during the birth, whether he was term, he was preterm, okay, everything you'll have to mention. Next in neonatal history you'll have to mention did the child require any kind of hospitalization, okay, or he had any abnormalities, that will come here. Next come the past medical history. Now in past medical history you have to write whether the patient has any kind of allergy, whether he was previously admitted, okay, everything will come here. Next come the nutritional history. So in nutritional history you'll have to mention whether the baby was breastfed, how long the baby was breastfed, then when were the complementary feed started and what they were started with, everything you'll have to mention. See, so here I have mentioned everything, you can write the same thing. Next come the calculation according to the RDA. So here you'll have to do the water requirement, the calorie requirement, the fat requirement, protein requirement and degree of malnutrition. Now for this, there is different formula according to the age of the baby. So if you'll want me to tell you about this, you can comment. I'll make another separate video on this. Okay, so see, so for my baby this was the calculation. So okay, so if your baby's weight is same as mine and their age is same as mine, then you all can do the same calculation. Okay, so you all can copy the same thing. Next come the 24 hours dietary recall. So you all have to write what the baby has eaten in full 24 hours. Next come the immunization history. So you'll have to mention the immunization till date, what all immunization he has received. Okay, so everything will come. So see, I have mentioned here this everything I have mentioned here. If not necessary, you all have to write this. Okay, you can just write the vaccination and whether he has received or not. Next come the growth and development assessment. Okay, so the growth and development assessment for toddler, preschooler, neonate, schooler, for all of them it is different. Okay, so my baby is now see, he's 2 years. So according to that I have written the I have here written the growth and development. Okay, so if your baby is 2 years, you can copy this. Okay, so see, the fine motor development, the self-help skills, sensory development, okay, then the language development, emotional and social development, play, accidents, intellectual development. So you all can copy the same thing. Okay, next come the activities of daily living, then is the family history. Okay, so you all have to write the 3 generations. Then comes the physical assessment. So in that you'll have to do the anthropometric measurement, the height, weight, head circumference, chest circumference, and also you'll have to write what is the inference, like whether it is achieved or it is delayed. Okay, then comes the physiological measurement. So you'll have to measure the vital signs of the baby. Okay. Next is the general appearance, then about the skin everything will come. Okay, the nails, then the lymphatics, head, how the head is, whether it is if the size is increased, whether it is hydrocephalus, okay, anencephaly, then the fontanelle, if it is closed, it is open. So everything you'll have to write. Okay, so same thing you can copy. The eyes, then ears, then the nose milia is present or not, then the mouth and throat, neck. You can go through this, everything is just same. Okay, Next is then comes the auscultation, respiratory system, then palpation. In auscultation, you'll have to write in respiratory system. You'll have to mention what is the respiratory rate. Okay. Then comes the genitourinary system. Then is the neuromuscular system. Okay. The about that. Okay. Then comes the back and extremities, everything about the cardiovascular system, then urinary system, okay, then genital. So everything you can copy same. Then comes the reflexes. Okay, so in reflexes you'll have to write sneezing, coughing, blinking. These two reflexes are enough. Okay, more reflexes are there like rooting reflex, okay, swallowing reflex, sucking reflex. So that you all can do for small babies. Okay. Next come the investigation. So this you will get the investigation you will get on their case paper. This we have to write. Then comes the treatment. So I'll have to write the baby is on which medication. So I'll have to explain about that, like the dose, route, frequency, action, indication, contraindication, side effect, assess responsibility. So everything no I've mentioned very nicely. You can write the same thing. Okay, in detail this is given. Next for template amlo. See, so nicely I've written. Okay, write the same thing. Since this is case study, so I'll have to mention the disease condition. Okay, so for that, since it was nephrotic syndrome, the disease condition of genitourinary system will come. Okay, so this is the diagram I have given. Then is the physiology. So the same thing you can write. Then comes the disease condition, like the definition, the types of nephrotic syndrome, then what is the pathophysiology. It's nicely I have written. Then the clinical manifestation, complications, diagnostic evaluation, management. Okay, nursing management, everything you all can write the same thing. Then you'll have to compare the patient picture with the book picture. Then is the nursing diagnosis. So according to priority, nursing diagnosis has to be framed upon the problems you have identified. Okay, so first is the fluid volume excess related to fluid accumulation. Then is imbalanced nutrition less than body requirement. Then fatigue related to disease condition. Then anxiety related to hospitalization. Knowledge deficit related to lack of exposure to information. Risk for infection, risk for injury, and risk for nosocomial infection. So all these diagnoses are kind of the same. Okay, 8 diagnoses I have given, and from that 5 I have explained. See, this is for fluid volume excess. See, very nicely I have written. Okay, every you all can copy the same thing. Then this is for imbalanced nutrition. Then this is for fatigue. Then next comes the knowledge deficit. Next is the risk for infection. Then is the health education. So according to the baby's need, health education you all have to give. Okay, so you have given for diet, infection control and hygiene, then immunization, growth and development, rest and sleep, and treatment and follow-up. Next I'll have to write the 3 nurses note. Okay, so I've given some date, medication, break, diet, time, and nursing intervention. Next come the progress note. So 3 days progress note you'll have to write. Okay, the same thing you can write. Next is the summary, and then comes the bibliography. So your 4 bibliography I have given. Same thing you all can write. Okay, thank you.